Hi, I'm Dr. Lou D'Amico with the Chippewa Chiropractic Clinic, and I'd like to talk to you today about the state of our current healthcare system. I've been in practice for almost 34 years as a pharmacist and as a chiropractor, and I've seen a lot of changes. Most of them have been very good, some of them have been not so good. The opioid addiction, for instance. It was done with good intent. We thought we had a drug that could help people with pain that was less addicting, and it turns out it was none of that. And now many thousands of people die every year. Most of them were hooked on these drugs because they got them for legitimate use of pain, and then became hooked on a narcotic drug instead. The current business model in healthcare is this: networks. Think Allegheny Health Network. Think UPMC Network. Think Heritage Valley Network. This is where these hospitals buy up the primary care practices, the OBGYNs, the pediatricians, and the orthopedics. They all work for the network now, even the physical therapists. And so when you go in that group, they want to keep you in that network. And if you go to your PCP, for instance, for back pain, and he recommends an orthopedic doctor, he's probably going to recommend an orthopedic doctor in the network. If he recommends physical therapy, he or she is probably going to recommend a physical therapist in that network. Now that might work out fine, and it may not. But trust me, you have choices. You can go to whomever you want within your insurance plan to get this problem evaluated. We always say in chiropractic, choose chiropractic first for your musculoskeletal problems. There are tons of studies now that show that chiropractic care is very safe and very effective, and one of the most affordable options. These drugs that are on the market now are very expensive. You have high deductibles and high co-pays that you have to worry about. And so you have to look at all this when you decide which works best for you. It's not always the medical model. If chiropractic can't help you, then move up into a more dangerous world with, let's say, drugs. Even drugs like ibuprofen, if you use too much, can create stomach ulcers and stomach bleeding. You have to be careful. Just because it's a little pill doesn't mean it's very safe. And then finally, if none of these options work and you need to go to surgery, well, then you have to. But it's best to walk up that ladder and not just go right to surgery, because once you have surgery, you can't undo it. And surgery is probably the most risky option for your particular problem. So just remember, you have choices. You did not choose your particular healthcare problem, but you can choose Chippewa Chiropractic Clinic. Give our clinic a call, let us evaluate you, and we'll be glad to tell you how we may be able to help you. Thank you.